now recognize the gentlewoman from Illinois, Ms. Underwood.
Thank you, Madam Chair, for holding this hearing to continue this committee's important oversight work on the humanitarian situation at our southern border. During my 3 oversight trips to the border last year, I saw and heard firsthand about the need for resources to improve medical record keeping. As a nurse, I know how important clear record keeping is when it comes to both patient outcomes and ensuring healthcare providers can most effectively do their jobs. In response to what I saw at the border, I'm so proud that we passed bipartisan legislation last year to provide CBP with an electronic health record. And just a few days ago, President Trump signed an appropriations package that included $30 million in dedicated funding for that electronic health record. Dr. Eastman, as a physician, can you tell us more about why EHRs are so important to your work at the border?
Yes, ma'am. Thank you very much. And again, thank you for passing the funding we need. EHRs serve a very specific function. They not only allow us to effectively document the care that's provided, but they also allow us easy access to the data to do things like quality assurance. It ensures that we're able to measure the care that we're providing. It ensures that we're able to assess the quality of that care, and it ensures we're able to learn lessons from that. In addition, an EHR system that we intend to develop will improve our ability to conduct disease and health disease surveillance using artificial intelligence techniques that will trigger the presence of potentially of an infectious disease before a human being could pick it up.
And again, from your perspective as a medical provider, how do EHRs help providers better communicate about patient care?
Yes, ma'am. So electronic health records, they're a complicated topic, but they allow us to describe the care that we've provided from the point of apprehension to the point of release from our custody. Not only internally, they don't only help us communicate internally across multiple settings, but they also allow us to communicate to external partners. And one of the things that I think is important in this hearing to mention is that the system that's provided not only protects migrants, the system that has been put together, it also protects the integrity of the healthcare systems in local communities, that were we not absorbing some of the blow, some of these local community healthcare systems would be overrun by the amount of care that's required.
ICE and ORR already have electronic health records, and we know that DHS has already begun the process of building one for CBP. Along with the dedicated funding, Congress directed DHS to come up with an implementation plan for this EHR within 90 days. So Dr. Eastman, can you give us an update on where DHS is in this process and what specific actions have been taken so far?
Yes, ma'am, I can. We are right now we're in the process, sort of the first phase of this, which is to identify some immediate solutions that can integrate the existing technology that's out there. That work is ongoing immediately. We're also working to plan for the long term. And we've hired a chief medical informatics officer who we think has the talent and the expertise to help us build a system that will not only create an effective, customized solution for us, but will harness our ability to help our operators do their job more effectively. Everything we do has to take into account the effects that it has on the individual operator who's doing the job at the border, at processing centers, and in ports of entry along the border.
So then what's next? What are the next phases in the implementation of this EHR?
The next phase is we work our fingers to the bone to try to get this plan together to come back to brief you in 90 days as to where we're headed.
Excellent. So you mentioned you hired this informatics officer. What date were they hired?
I'm sorry?
What date were they hired?
Oh, I'll have to take that as the specifics as a question for the record. He's been around 5 or 6 months.
Okay. And in your medical opinion, why is it so important to ensure CBP's EHR is interoperable with those used by ORR and the other DHS components?
Thank you, ma'am. Again, we want to make sure that we're able to provide a seamless picture of all the care that's provided from the point of apprehension to the point of discharge. It's important for a provider at ICE to know what happened upstream of that when the person's for the care that's provided in the Border Patrol. Now, that being said, we're working hand in hand with the Border Patrol to make sure that the solutions that we craft together not only accomplish the goals of the EHR, but also are user-friendly and don't add to the load, the processing load, the time that the operators have to put forth to take care of the migrants in our custody.
Well, I appreciate those operational benefits, but the other benefit of an electronic health record is obviously saving lives. We're not missing information, we're not losing patients, and we're not missing opportunities to identify infectious diseases or changes in current status. We're heading into another flu season that's projected to be severe. Dr. Eastman, you noted in your testimony that you are working with CDC, ASPR, and other public health agencies to improve CBP's response. So what specific steps has DHS taken to strengthen its ability to respond to flu outbreaks at the border during this current flu season, which we know has been particularly harmful and deadly for children throughout the United States?
No question, this flu season, according to the CDC and other experts, appears that it may be rough. We have worked hand in hand with CBP to help craft enhanced flu control measures that were crafted with input from experts from the CDC when they performed a 3-phase assessment along the border very early on in the crisis. In addition, we've helped provide CBP with the ability to rapidly diagnose and treat the flu in our facilities at CBP. Again, that capability is present now in over 40 facilities along the southwest border, and I would challenge folks to find another law enforcement agency that diagnoses and treats the flu on the law enforcement side, not the custodial side.
And Madam Chair, if I may, just one last follow-up. What date? Was it new for this flu season that rapid capability has been deployed? Because it's not our committee's understanding that capability was present last year. So
that's been developing all along through the course of 2019. So it's as the contract support has been developing, that flu capability has been put into place, continuously over the years.
Okay, thank you so much, Madam Chair, and to our witnesses for appearing today. I yield back.